webinar of the year on the topic Foundation of Mental Health, Why It Matters for Everyone, with the objective to build awareness and understanding in society. This insightful session is brought to you by Ecocivilisation in association with Vaha Women and Terra Siva. I am Dr. Rajni Vohra, founder of Vaha Women, and I am honored to be joined by distinguished leader Dr. Violeta Bulc, who is founder and curator of Ecocivilization and former Deputy Prime Minister of Slovenia and EU Transport Commissioner, alongside my co-host Eleftheria Kakambura, founder of Terra Seva, Consulting and Education. So friends, as you all know that in recent year, mental health has rightfully gained the attention it deserves. And as a progressive society, we believe that it should be no longer an individual concern, but a collective responsibility. So this growing awareness and sense of responsibility toward this issue has led us to come up with open conversations like this. And to delve deeper into this crucial subject, we have invited today three brilliant speakers who will share their expertise and insights. On that note, it's my privilege to invite Dr. Violeta Bulc to share a few words with us.
Thank you very much, Rajni. It's a real privilege first to greet you all. As Rajni mentioned, this session today is one of the sessions in the series, The Year of Mental Health 2025, led in very special times, I would say turbulent times, where the importance of knowing who you are is even greater than ever before. To be able to face all the dynamics and chaotic conditions around us, as we often call them VUCA conditions, which are very much fostered not only through the human behavior and the need for constant change and constant redefinition of everything that we exist within or we do. It's also fostered by the huge change in the natural cycles. The scientists say that 12,000 years of stability is now being replaced through the very dynamic and turbulent and even chaotic times with the so-called Anthropocene era. So Holocene to Anthropocene. And for that is the most typical thing is that nothing is any more predictable. 12,000 years of predictability in climate conditions, in temperature, in seasons, now all of a sudden seem to be a bit off sync. And this will continue until the planet Earth stabilizes again. Of course, we humans have done damage to these cycles, so that makes them even more unpredictable. With our behavior, with our pollution, with constant exhaustion of natural resources, we are challenging the natural cycles. And even the planet Earth and the whole laws of physics, we don't know how they're going to react. So that is even more confusing to people. So it's not a coincidence that we speak about mental health so much, especially in the framework of Western civilization, where industrialization, on the top of everything that I already said, has caused a damage deeply in human souls when, due to this real push for industrial mindset and delivery on productivity and costs, detached people from the nature itself. It doesn't mean that humans in the past were not challenged, but nature was able to support us deeply and sustainably. Today, the concrete walls do not give us a nurturing feeling, right? I think every one of us can relate to that. In addition to that, the industrial mindset really pushed us to focus on very cold elements of modern society, which have nothing to do really with humanity. So we forgot about empathy. We forgot about the intelligence of really deep relationships that bonded humanity for so long. So we detached ourselves from each other. So even the empathy cannot find its way in a troubled times to the heart and soul of humanity. And that is another alliation that causes challenges in our holistic existence. And if that was not enough, through creation of virtual space, we started to push humans to detach even from themselves, we from ourselves, imagining something we were not through different types of avatars and trying to identify with something which was not our authentic essence. So all that is causing, of course, in this natural, beautiful body that we are, and we have to say that we are nature, is causing a lot of challenges. Challenges that we have not spoken about. Challenges that became a taboo because they were challenging the establishment, which did not want to talk about the consequences of this really cold, industrial, technological based society that started to put technology as a goal instead of just as a tool as well. How can we find, we humans, with all beautiful dimensions of intellectual, physical, emotional, spiritual, social, even energetic levels, how can we identify with that when we know that life is so much more than just technology? So that's why we decided within Ecocivilisation, who is really connecting people who care and who started to spread all over the globe and find its representatives now in 51 countries, with a different type of challenges, but with one thing that brings us all together. We're people who care. That's why we engage. That's why we discuss. That's why we constantly search for answers who will keep us in the path of holistic development, on the path for humanity with the future. So away from transhumanizational concepts of our future, closer to ecological civilization, something that brings forward the best in humanity while using technology to, of course, achieve those goals as a tool. So I'm very, very honored and happy that we have our guests today. And congratulations to Rajni and Eleftheria to bring forward this special session today, which will address from a specific point of view, the challenges of mental health. And this will continue throughout the year. So we will see and hear many different views. So I'm already inviting you to the next month's session, which probably Rajni and Eleftheria will do themselves again. And I'd like to say that at the end, I'm looking forward to a new book that will come out of the Ecocivilisation circles, which will include, hopefully, the contributions of all our speakers and those who care and are interested in the topic. So thank you very much. Welcome to this second session on mental health. And back to you, Rajni and Eleftheria.
Thank you so much, Violeta, and congratulations to you too. And thank you so much for your profound and enlightening words. Again, reminding us of the importance of collective action in fostering mental well being. And now it's my pleasure to invite my dear friend and co host, Aleftheria, to set the stage for today's discussion and guide us into this crucial conversation.
Thank you. Thank you so much, Rajni. And I just want to thank everybody again for your time and for your presence here on this collective, crucial topic that we're discussing. Already we have a little small collection. I believe in the power of community. And I think already with us just connecting and gathering here on this topic already, we're sending ripples out into the world. On caring, since we're all really truly interconnected. What we believe as eco-civilization is that prioritizing mental health, we really can start laying the foundation for a thriving eco-civilization. And echoing what Violeta shared with us is this idea that we're not separate from nature, but that we are interconnected with nature. And so from that point of view, as all life breathes together, I would love to invite all of us to just take a moment to ground, to become fully present in our bodies. And so I invite you to just take a moment, either with your eyes open or your eyes closed, whatever feels right to you, to just feel your feet planted on the ground. And just call all the parts of yourself back present to this moment, this time, and this place. As we turn our gaze inwards, I invite you to just take a deep belly breath in, following your own rhythm and your own breath. And on the exhale, just exhale out your mouth with a sigh. And just scanning your body for a moment, just notice how your body is feeling today, without needing to fix it or change it, just noticing. And noticing how your heart is doing today. How are you feeling today? Just observing. And I will just invite you in your own way to perhaps just express gratitude for one blessing you already have in your life, in the world. And we take another slow, deep belly breath in, just becoming fully present in this amazing body. That's probably the most advanced technology there is in the world. And we wiggle our fingers and wiggle our toes. And when you're ready, I invite you to gently open your eyes and just see through the doorway of the heart. Thank you. And so now, Rajni, I'm going to pass back to you. And I'm super excited for this conversation and to learn more.
Thank you, Eleftheria, for this relaxation session. Though it was very brief, nevertheless, it was very powerful, and it actually made a lot of sense in the beginning of the session, which is especially on the mental health. So thank you so much for setting the perfect tone for today's session. And now we are ready to dive into this enriching conversation with our esteemed panelists. So let's begin by welcoming our first speaker. Our first speaker today is Dr. Swati Karve, who brings 30 years of experience in mental health, education, and organizational learning and development across India and the US. She is the CEO and founder of Swasti Vishwa Behavioral and Social Sciences Institute Foundation, a Section 8 non-profit company dedicated to creating impact through affordable education services research for individuals, organizations, and communities. So let's give a warm welcome to Dr. Swati Karve. Dr. Swati, over to you.
Yeah. Uh, I'm supposed to begin, right? Okay. So I have a very short presentation. Thank you so much, Violeta, for that wonderful context setting, and Eleftheria for that beautiful grounding session. And what I'm going to do here is just talk in general about mental health, really like mental health 101. What is mental health? What is mental illness? And then our esteemed panelists, Dr. Om and Helen, will be talking about their perspective. So my agenda was to give like a 101 introduction. So here's what I'm going to dive right in. So this is a short presentation, and in interest of time, I may not show all the slides. I may not speak about all the slides. I just want to keep it like an overview. So though you may see some slides, I may not I may not present them at all. So we are just going to cover in brief what is the concept of mind. I mean, when we say mental, we need to know what mind is. One of the most important aspect in mental health is role of stress. And Violeta has brought in her little introduction the importance of stress in today's world. I mean, the ecology is also a part of our environment. So how stress plays a role in mental health, the mind-body relationship, the biopsychosocial model of mental health, understanding mental health, and the importance of mental well-being. So in the next 10 minutes, 10 to 12 minutes, I'm just going to run through this as just an introduction so that we can have the rest of the session for question answers and our esteemed panelists to present their perspectives. So when we talk about mind, mind is nothing but working of the brain. And there have been a lot of philosophies, like millennia have tried to define what mind is. And then they say mind is not just the body, but it's something more. But remember, to perceive that something more, you still require your brain. So mind is nothing but working of the brain, and therefore mind and body are very intricately related. So let's start with this. And this is a very, very broad topic. I'm just going to give the gist of it over here. Now, if you really look at mental health and wellness, how does wellness look? So absence of mental wellness is stress or mental illness if it goes to a larger degree. So mental wellness, when you look at it, there's no stress, or stress is within our control. Stress is a part of life, but we have control over it. Good physical and mental health, good family life, generally positive emotions, positive self-concepts, motivation to do something, good friendships, no conflicts, good quality of work life and a work-life balance. And there is so much more. I mean, I've just put a few points here. There's much more. So mental wellness is a condition uh, of not being stressed or not being ill. That is mental wellness. And all the time, our goal is to achieve this mental wellness. Now, how do we do this? Now, we have some domains in our life, like we have our personal life, our professional life, our social life. And all these domains of our life have to be in balance. And these domains overlap. They overlap. Like your personal stress can go into your work life, your work stress can go into your personal life. And talking about environment and ecology and all that thing, just imagine those cities that are so crowded, all that traffic, all that stress you're taking to your work, and there's noise all around you, and that is causing stress. So everything that causes stress, when things are going smooth, there's balance in these domains. But what happens is when the balance breaks down, then it causes stress. And this breakdown can be in any domain. There can be any reason. And there can be a lot of stress where we are pressured, where there's a lot of frustration, there are conflicts. And the stress from one domain spills over into other domains. And when you cannot handle it anymore, that can cause a breakdown. So I'm going to skip over all the theory, just giving you the main points. Now, stress is defined as a condition where the body does not have resources to meet the demands of the environment that has been placed on that individual. So the body cannot handle it anymore. And then what happens? the body gets ready for this flight or fight response. Fight is to take it on. So if I'm anxious about something, I take it on. And flight is to avoid it, to run away from it. So the body is ready. But what happens to the body? Remember, the body is a biochemical machine. It's the best technology, like said just said. There are neurotransmitters and hormones, and your immune system is involved. And all these, when the stress just doesn't go away, it causes a type 2 chronic stress, and all those stress hormones build up in your body, and then it starts causing problems with your heart, with your digestion, with your muscles, and it leads to pain and diabetes and insomnia. So many illnesses can happen if your stress is not addressed right away. There is a big role of chronic stress. And what happens with chronic stress is, if you do not address the original source of stress, it leads to reactions to the stress. And those reactions can cause complications. And that can cause a lot of. So, for example, an important presentation has come up. You become anxious about it. That is the original stress. This can lead to various reactions, your thoughts, emotions, behaviors. So these are all reactions. You start thinking, hey, I can't do it. And then you feel anxious, you feel afraid, you start worrying. And then you say, okay, I'm not going to do it. Flight or fight, right? I'm not going to do it. But if you avoid it, then you again start feeling negative about yourself. So self-concept is affected. It can cause a lot of problems, like you may not be able to sleep. You will start getting acidity or acid reflux. You start, so there are so many things that happen because of those secondary reactions. And this chronic stress can then lead to anxiety, depression, sleep problems, digestive problems, and all these physical or mental illnesses, or even relationship issues. So stress, the chronic stress has a big role to play in mental health. Now, what is mental illness? Now, mental illness, when we say stress causes physical and mental illness, what is mental illness? Now, mental illnesses are these broad health conditions that involve changes in emotion, thinking, and behavior, and they are associated with distress and problems in your normal functioning in different areas of life. So they can cause issues when there is distress in the person, or distress in relationship, distress to other people. Then you can say that somebody is mentally ill. Now, mental illness does not mean intellectual disability. Now, this is very important, that if somebody has a low IQ, they're not mentally ill. Okay, learning disability, Alzheimer's, they're not mental illnesses. They have consequences where you need the help of a mental health professional, but they by themselves are not mental illnesses. So how do we approach this? Mental health is a very broad area. Anything that has to do with mental health or psychology or behavior science has to have what is called as these perspectives. It always has this. We are the product of our biology, we are the product of our psychology and our society. So the biopsychosocial model explains the various reasons for mental illness, or they can contribute to a lot of risk factors. When we say the biology, it's all our genetics, our prenatal factors, our health conditions, our nutrition, hygiene, sleep. I mean, the whole thing that directly affects our bodily processes, physiology, anatomy, all those things. Psychological factors are personality factors, your experiences like your trauma, and you might have had childhood trauma, your early life environment, you have chronic stress. So these are some of the psychological factors, your emotions, how you regulate your emotions, environmental factors like pollution and crowding and noise. They can be risk factors. Social factors, relationships, conflicts, workplace issues, and then of course your behavioral factors, which end up, bad habits and maladaptive behaviors, addictions of different types. Now all these are risk factors. Now these behavioral factors are also consequences. right? They are also consequences of these factors. So it's all cyclical. Now, a lot of these factors, the biological factors or even personality factors, all these are risk factors. Now, remember, not everyone with these conditions will develop that mental illness. Now, the type of illness varies based on the individuals, how these factors interact in every person's life will determine if what type of illness happens, whether it happens, to what degree it happens. Now, one of the important things to know in mental health is because this is very, very individualistic, these individual differences are reasons that mental health is not understood and it is stigmatized. Because people will say, hey, I could handle it. Why can't you handle it? But that why can't you handle it? Because that person is different. And this is what people generally do not understand. It gets stigmatized. So remember that mental health is individual. And there are many different types of mental illnesses. There are mood disorders, anxiety disorders, personality disorders, psychosomatic, psychotic, eating disorders, trauma related disorders like PTSD, substance abuse disorders. Now, how do we diagnose this? There are certain standards, there are the DSM criteria, there are the ICD-10 criteria. So the professional has to diagnose this. Please don't Google something and diagnose yourself, because these days Google has become like it gives you information, but don't label yourself that I have OCD. I mean, OCD is something that people constantly label themselves. No, OCD is a disorder. If you are perfectionist, don't call yourself an OCD, because Google will tell you are an OCD. Look, lot of myths that people with mental illness are dangerous, they're weak, they're faking it, they're doing it just to seek attention. Children cannot have mental illness. Remember, the child suicide rates have skyrocketed. Mental illness, the numbers are out of the roof. Depending on where you're looking at, you look at like 10% to 30% people. Somewhere, some studies say 70% people. Everybody has some condition or the other. It can just go away with medicines. Yes, medicines are very important, but some illnesses don't go away only with medicines. There's work to do. It can go away by just walking or exercises or ignoring it, or only therapy will work. Only therapy also doesn't work for a lot of illnesses. You need medicines for that. And one of the biggest myths is mental illness cannot be cured. There are cures, there are people have recovered, people are very well functioning. So this is a myth that mental illness cannot be cured. And there are advances in psychiatry and behavioral medicine over the last 20, 30 years, which have made a lot of techniques and therapies possible. Now, if you feel that your stress is, you're very overwhelmed and you cannot get help, then please go and see a doctor or a mental health professional. This mental health professional must be a qualified mental health professional. Please don't go to a quack. That a detailed case history needs to be taken. There are medical diagnostics, there are psychological tests like psychometric tools, there's behavioral observation, and based on all the reports and case history, the psychiatrist or a licensed psychologist will be the person who will make a diagnosis. So this is very important to know, all the attendees here. Please go to a qualified professional to get a diagnosis. Once the diagnosis happens, then the treatment can start. So depending on how you approach the doctor will tell you whether you need a test, whether you need a blood test or any other test. So there are medicines, there's counseling, there's therapies, there's a lot of holistic approaches. So holistic approaches will also elevate your mental wellness. And what there are different types of professionals who are involved in mental health, like psychiatrists, psychologists, counselors, social workers, psychiatric nurses. Remember, these are all people who with highly advanced specialized degrees in this field. So they are people who know the background, they've got the experience. And of course, there are a lot of allied healthcare providers who also work in the field, like occupational therapists, physical therapists, learning disability specialists, special education teachers, so many. So we need, when we talk of mental health, we have a lot of professionals who also work in this domain. One of the most important part is being psychoeducated, and this webinar, for example, is an example of psychoeducation, where we are educating, where we are telling people about this topic. It is extremely important to need to know about mental health, get the treatment, understand the nature of your illness. One of the important things when a client comes to us, for example, we tell their family members how to respond to the person with a mental health, because caregivers also need therapy, they need help, they need they also need treatment or support. What support to look for, and of course ensuring self-care. And from mental illness, we move to mental wellness, and of course, changing lifestyle changes, making those, exercise and diet and sleep, managing your relationship, changing the way you think, and managing your physiological responses. That means taking care of your health. All these are very important for self-care. Now, where to begin? Give a me time, being kind to yourself, reframing your thinking, reflective journaling, traveling, being with nature. I mean, we started with eco-civilization. Being with nature is a very important thing. Learning to say no. So skills like assertiveness, read a book on self-care, do something and take charge of your own mental health. um, I have a program which is called Seven Powerhouses of Motivation. This is a mental wellness program which has these 7 steps or 7 criteria, and there are a lot of activities around each one of this. There are practices. So I have offered this workshop during the pandemic at least 14, 15, 16 times to different groups and corporates and community groups. So if you're interested, I can talk about this in some other session. And final thought is, find the right balance. Reach out to someone for support. Seeking help is not the sign of weakness. Seeking help is a sign of strength, that you are taking charge of your own mental health, and you are in fact giving power to yourself. You are empowering yourself. So know that seeking help, seeking support, seeking medicine, seeking therapy is not a sign of weakness. And there are so many options for you to get well. So be the architect of your own future. And this is where I have just given a very broad overview. I hope this was sufficient, but our panelists will probably deep dive, and I'm also ready to take questions, and after all are done, or whenever. So thank you so much for inviting me. I'm extremely honored to have done this presentation and being a part of this amazing group. Thank you so much. Yes.
Thank you so much, Dr. Swati, for that comprehensive and insightful presentation. In fact, I'm extremely happy that you touched some of the very important, crucial points, especially the point of, uh, you know, finding your disorder through Google and self-diagnosis, which is very, very harmful. And because it has become so easy, so instant for all of us, that everybody feel that it is absolutely right thing to do. Okay, just Google it, just find out what the hell is happening to my body. Dr. Swati, I have a question for you. You being a clinical psychologist, in your experience, what percentage of patients get cured only by counseling, in your experience?
In my experience, depending on the severity of the problem and the nature of problem, counseling can help. But if
Right.
the disorder is severe, disorder is psychiatric in nature, then you do need medication and therapy. So, unfortunately, I don't have statistics about this. I
Mm.
don't think there are statistics exactly like how many percentage of people get well only by counseling. But I can tell you that folks who, depending on the nature and the severity of the disorder, there are people who get well by counseling, but there are, if it is severe, they need medications.
Right. Because I have often seen most of the times, I have experienced, at least in my country, in India, majority of the people, they do not know the difference between a psychiatrist and psychologist, first of all.
Right.
So
Absolutely.
initially, they are totally confused whom to approach, whether to go to a psychiatrist, psychologist for counseling or what. So they're totally confused,
Correct.
and a majority of the time they expect a psychologist to prescribe some medicines
Mm.
because of lack of awareness. So I
Yes.
think through these webinars we are trying to create that awareness only,
Yes. Yes.
that at least people should have the fundamental idea, because when you
Yes.
have elementary idea, then only you can approach the right person and you
Yes.
can help yourself before others will come to help you. So thank you
Yes.
so much for this insightful answer, and once again for this
Thank you.
presentation. And Violeta and Elifthiri, do we have any question for Dr. Swati at this moment in
Well,
the question
nothing
answer
from the
session?
audience so far. I now enabled everyone if anybody wants to say anything directly. But if I may, one very short one. Since we're dealing with civilizational paradigms and that, I mean, what would you say or can you share with us some typical challenges that are rising out of this conflicts that we are seeing right now about all these incredible changes in social structures, in political landscapes, in relationships with within families and each other due to some technological apps or any other
Mm.
tools?
Yeah.
What is your stance in that area?
Absolutely. I mean, these webinars also give us an opportunity to think through because these are very important questions. So, one of the things that that keep coming, like I've been doing this for last 30 years,
Hmm.
but in the modern times, it is always about the changing values. The values around family, for example, that is changing. uh, a lot of materialism, so people chasing, there's a rat race. The whole issue of like I mean, we do counseling for so many people, so there are people who have come from small towns into the cities, they can't integrate, the suddenly the value system is different. So the just those values cause so much of stress, so much of conflicts. The this cell phone is like a curse and a blessing at the same time, right from very small children who are not eating. I've seen parents putting this cell phone on and trying to feed the kids. I mean, what is it doing to their brains? So you have so many instances of ADHD and all these things, which there are lots and lots of studies which link all these things together. There's a lot of research which has been done. And you very rightly said the modern living has made things like we have really brought it on ourselves. So we see this in the practice. Yes. So there's a lot of cultural, social values which have contributed. Like I said, these are all factors of mental illness and mental health, and we actually see it in our practice.
Thank you so much, Dr. Swati. And we request you to stay with us because you know that
Yes.
we have two more wonderful speakers.
Yes.
So please stay with us.
Absolutely.
And thank you. And moving forward, it's time to introduce our next speaker, Dr. Om Bedekar, an experienced psychiatrist with 35 years in the field. Dr. Bedekar holds an MBBS and diploma in psychological medicine, that is DPM in short, from the University of Pune. His career spans across the Indian Army Medical Corps, Muktangan De-Addiction Center in Pune, and Maharashtra Medical Services in Nagpur. He later served in various defense organizations under the central government in New Delhi for 25 years. a strong advocate of minimal medication and holistic psychotherapy. He believes in helping individuals break through their suffering at the earliest using the latest advancements in psychiatry and psychotherapy. Dr. Saab, we are honored to have you here. Over to you.
Thank you very much. Can hear me, I hope?
Yes.
Yes,
Yeah.
sir, we can.
Yes. And the latest is that I have founded the first chapter of the Milton Erickson Foundation in Pune. I got a license to use the name of the Milton Erickson Foundation, of which I'm practicing the therapy. So my model is based on the Milton Erickson model. Yes, so my name is Dr. Om Bedekar. I'm from Pune. Lovely to be here with all of you, those whom I can see and those whom I cannot. Yeah, and mental health is a vast topic which can be finished in a few words at times. The whole crux and the whole this thing, like what we are talking, all this not civilization, the urbanization and the heating up of the economy and all this pressure and all this running around and all the economy getting very hot and people going for money, 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 and so on. If only we could abolish money, the things would possibly, in the barter kind of system, perhaps. However, that seems a bit remote because the people who can abolish, they want more of it. And so they will not let you. So the number of billionaires is increasing all the world over, and the number of mental health problems is increasing all the world over. Proportion is there, apparently. There is some relation with that. Yeah, so after these general remarks, I would like to say that we are now in a global world and we are connected to each other, like we are using this technology. And so the stress and everything now is universal to all of us. We are transmitting stress just as we are transmitting information and we are transmitting ideas and so on and so forth. So, um, yeah, so my view about mental health is that uh, there has been a lot of medicalization of human experience, which comes due to human doings, and that can be reduced, that needs to be reduced. This is, of course, I tell this to all the medical people and the others also. So we didn't over medicalize the things, a simple grounding experience, a simple this thing. Actually, mental health is not so complicated. It's just that we have made it complicated. And how complicated have we made it? We have, it's like a bomb. It's like a time bomb. And it's bloody everywhere. It's a pandemic. And in the coming time, there are other, like, time bombs which are coming more and more and more and more. And like Dr. Swati said, the cell phone can be a boon and a bane. So many things are there which are going to literally occupy the minds of children from now on, that I really feel lucky that I was born earlier rather than, in the coming generation. I'm worried. I'm very concerned about my next generation, and I can't think of what is going to happen to, if there will be a next generation after that. Yes. So because everything is going virtual, so it's difficult. Yes. And now coming to how lifestyle. So lifestyle is impacting us in these ways. And digital workload, work-life imbalance, social isolation, despite huge connection, economic uncertainty. Nowadays, jobs are very, very uncertain. Now we are moving to so-called gig economy. So we are making a gig out of life. So that's also very, very difficult. In the olden days, people used to work for like 30 years in one employer, get a pension, and so on and so forth. And I think Europe still has the pensions for everyone, but in India we don't. And I tremble and shiver to think of what the people will do when they don't have pension and they will be 65 years and 70 years and 80 years old. Horrifying, very, very depressing scenario. I can't imagine it. And then, yeah, so what should we do about this? What to do about this? So think global and act local. That's about the only thing we can do about this. The big boys play their big games on Mother Earth, and we have just to, like, participate and be there, and we can't do a damn about it. So what we can do is actually we can do, what can I do? All change begins with one's own self. So said our great one person from India. So, the only thing I have in control is this, this 6 foot, say, of material which is there with me, and the thing is to start working on oneself. So, what can one do to keep one's mental health intact and not get screwed up? First thing, movement, physical exercise, movement. Hell of a lot of movement. It'll take care of many things. 5 kilometers, 5 miles, 6 miles, whatever you want, not less than 5 kilometers. Go in the woods, go in the city, walk in the house, walk in the flat, walk anywhere, walk in the gym, walk in the toilet, walk anywhere, but walk, move your body, move your everything. Yeah. So this is movement, and movement is very effective because that is also one of the things which has been affected. Earlier, we were all spread out like, and now we are just closed. So we have to move so that we have a semblance. This body is created that way. The system is created that way. So we have to move. And second thing is diet. So I have to choose and eat well. So I go to Namaste restaurant in Ljubljana and have nice food there. Or I go to, basically what I mean is we need to have fruits and juices and vegetables and all those things. Google will give you a lot of information about it, which will be roughly all right. So in that case, you can rely on Google, and you can take some supplements also, but movement and food, balanced diet, protein, carbohydrate, you know it all. In case you don't know, you know where to look it up. The next thing is, what else can I do about it? Yes. So the next thing is, just like I have a bath every day or a shave every day, or I have a haircut every month, or, I wash my clothes, I get my clothes washed and all that. So all this is prevention and maintenance. So we have to do prevention to get our health all right, to keep our health all right. So prevention means what? It means first you did the exercises. Now you can add yoga, you can add some spiritual practice to that. So these are 2, 3 important things. A certain amount of psycho-spiritual work daily, say 20 minutes, 30 minutes, is mandatory if you wish to be sane. If you choose to be insane, have a ball. Sponsor us. We are the professionals. We look after you. Yeah, we make money on that. But if you wish to be sane, and I hope you like this and you're not offended in any way. So if you wish to be sane and this one, then you have to do 20 to 30 minutes of psycho-spiritual work What does that mean? That means something like Tai Chi. Somebody mentioned Tai Chi. Tai Chi, grounding. Everything is taking us up, up, up every time, you know. So we have to bring ourselves on the ground, 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 ground. So when we are grounded, then we'll feel all right. Half the things is the grounding. And then there are a lot of things. And there are, but there are huge, so there is meditation. There is different kind of meditation. I am very fond of Vipassana meditation by Goenkaji. So that is because I experienced it and it was very good and very useful. So something like that, it is like cleaning up your mind, maintenance, washing, nothing very great, but very, very important. Otherwise you'll rot and decay and fester and have gangrene in your mind and brain and heart and spirit and everywhere. And then you'll need amputation. Right. So, yeah, what else do I want to say? Time is over? Yeah,
No,
well,
sir. Please go on.
okay,
You
okay,
can.
yeah, yeah. Someone is talking on my phone. Okay. And how do you cultivate resilience? So to cultivate resilience, quality sleep is there. Sleeping is very important. And sleeping at the right time is most important. Sleeping at the right time because of electricity. See, this electricity is also like the cell phone. Nowadays, we have continuous electricity day in and day out, and enough and more. And then we have inverters and generators, and this one and that one, and all this thing. So we are just having plenty of light, you know. Sometimes I wish that they were not so efficient, you know, all these plants and all. And sometimes I wish Violeta, the legislators will look into this aspect that the bloody electric current should be stopped at 10 o'clock for domestic use and only the roads and all, you know, wherever they are. This is a mandatory thing now. This is like ABC level, first standard level, but this is something which is difficult to implement. I don't know. Is it so difficult? Actually, it is so simple from 10 or 11 in the night till 6 in the morning, especially in small, small cities and cantons and counties and all these places. You can try this experiment, legislate about it, that there will be no electricity in the house, except probably for the fridge. I don't know what you'll do. But, you know, something like that, something creative and different we have to do if we want to keep ourselves sane and sober and enjoy life and feel lively and have a nice time. I think I'm done. I'm open to questions.
Thank you so much, Dr. Bidekar, for that thought-provoking presentation with some very pragmatic tips to keep one's body and mind healthy and lively and I mean, wonderful, wonderful. Uh, I have a couple of questions for you. And my first question is in general, I have seen that most of the times people don't realize when they need professional help. They often justify their struggle as logical reaction to certain incidents or events in life and avoid seeking support. So, if you could enlighten us about as to what are the warning signs or kind of red flags that indicate that it's time to consult a psychiatrist or psychologist or some sort of help. What are those red flags?
Yeah. So remember the figure six, number six. For bereavement, grief, loss, death, separation of a loved one, for very serious things, it takes about 6 months to recover. Apart from that, normally 6 weeks se zyada you shouldn't wait. Like 6 weeks is a hell of a lot of time. So 6 weeks of depression, 6 weeks of anxiety, 6 weeks of relationship issues, and so on. So I mean, I'm giving you very basic and like, you know, practical kind of stuff. So 6 months for bereavement, grief, serious matters like death and so on. So that takes time. But then people take 4 years and 10 years to leave their, you know, parents and all that. So that is where we come in. So we come in after 6 months. 6 months it takes. Rest of the thing, 6 weeks, more than 6 weeks of any discomfort and all that thing, go and see a therapist.
Yeah.
Secondly, I'm just expanding your question based on my experience of the worldwide doctors. Gastrointestinal disturbances, gastrointestinal disturbances, which don't have, like, there may be not a manifest anxiety and depression, all that. If you're smart and you have gastrointestinal disturbance for more than 6 weeks, go and see a psychologist or a therapist or a psychiatrist or somebody. So that will be a good investment. That will be a smart investment. You'll save yourself a lot of money, a lot of time, and you'll get better earlier. Yes. Now,
Okay.
let me see if there is any qualitative thing I can tell you. So qualitative is very simple. If your life is getting affected, if you are underperforming in your work, if you are, yeah, so like that, then you have to go and see a therapist. So
Right.
nowadays, fortunately, nowadays people are coming. They're more aware. They're coming, and yes, but sometimes, yeah, they need a guideline. So just remember 6 weeks. 6 days of suicidal ideas, too much. Yeah. So that will be like 6 hours, here. So just remember six. It's easy, and there's the resonance and the rhythm and thing to that.
Right, right. Because majority of the youngsters, when they go through relationship issues, especially heartbreak or breakup, so they are, first of all, they do not want to disclose to their friends or to their family, and once parents come to know, by that time it is already too late.
Yeah, yeah.
So even if this webinar is being watched by many youngsters, so your advice would be to see in 6 weeks if they recover. Otherwise, they need to seek help outside from counselor or psychiatrist. Is that what you
Yes,
mean?
yes. Yeah, yeah. Breakup hurts like anything. One of the other formulations I have, and many people have, about psychological illness and ill experience of psychological distress, or whatever you want to call it, is lack of love.
Mm.
When there is lack of love in life, then you get anxiety, depression, this, that, all kinds of bullshit. And when there is love in your life, then you're okay, you're floating. So you're in a good state. So breakup is very significant that way, because they will boom, get stuck on your heart, like that. Sometimes it's like a spear driven through your chest. Sometimes it's
Mm.
like a dagger. Sometimes it's so many things. So these are the actual literal experiences which people have. So
Right,
yeah. So yes. So breakup is very important. The earlier you go, the better it is.
right.
And breakup
And
is part of life till the next breakup. It's like that. So what we do is, what the doctor does is, what the therapist does is, now he's got a bam. So he's like this. So he makes him like this and ready for love. And then after some time he goes and has love. And then again there may be a breakup. And again there is this thing. So this is going to happen more and more, because nowadays we don't believe in, yeah.
I have one more question. Eleftheria, do you have any question for Dr. Bedekar? Violeta, do you have any question, or shall I ask one more question I have in my head?
Go ahead.
So,
Ask.
yeah. So my question is, it's a widespread notion that once somebody is on medicine, will always be on medicine. And that
No,
is the
no.
real fear why people do not want to approach any psychiatrist, because they
Yeah, yeah.
nobody wants to be on medicine forever. Is it true, or it is just a misconception?
It's total misconception, but sometimes encouraged by, how do I say it, by some people who rely more on medicine. So, yeah, like big pharma and things like that. Big pharma will love you to have medicine. Big pharma is one of the bloody agents among all these things which we have mentioned, and, which we have forgotten to mention, is big pharma, one of the big culprits about your physical, mental, and all kinds of health. Yes. So there is no need to take medicine if your therapist is competent, and like you are from Earth and not from Mars or anywhere. Then it's simple. It's brief. What we do is brief, like this. Make it straight. That's all. Very fast. No
Okay.
problem. You need a
Thank you.
competent therapist. Yeah, you have to get a competent therapist. Go for
Thank you.
somebody who has 4.5
I think
stars or more on the
I think
Google.
we have received one more question from one of the participants, and if I may
Yeah.
take it, uh, uh, because somebody has questioned it that uh, that they have noticed a pattern when someone struggles with stress for 3 days, but then seems to bounce back to normal. Could this pattern be indicative of an underlying mental health concern, or is it simply a common stress response?
Based on this information, unfortunately, I'm sorry, Indrani, but I really cannot uh, make some real this one, Yeah.
Okay.
Uh, that is very
And
the question is very incomplete for my
oh,
opinion.
and this
Uh,
this pattern, I'm sorry to interrupt. This pattern is continuous, every 3 months, every 6 months. It's not one
what?
or two times. So I observe this pattern every six
No,
months.
no, no. Maybe when your therapist observes the pattern may be different. So,
Mm,
I'm extremely sorry, but I really cannot
no problem.
do justice to this question at this moment.
I can understand. Thank you.
Yeah, you can contact me. You can take my name and number. You can Google me and take my number.
Sure, sure. Thank you.
Yes.
Yeah.
Yeah. Yes. Somebody else
Um,
was saying something.
yeah, we have one more question, but I think we can take that question later on in the last question answer section, because we
Yeah,
have
yeah.
one more speaker
No,
with
let me
us,
finish
Dr.
this. Let me finish this. Just 1 second.
Okay.
He's saying death in the family 3 years back and all that. Please consult. Please go to a therapist. Please, please, please go to a therapist. Sort it out. Don't wait for another 2, 3 years. Go and do. You'll spend a few thousands. Doesn't matter. It will be money well spent, and you'll be taken care of. You'll learn number of new things. It'll be good for you. It'll be an investment for you. Please take help from a qualified therapist. Yeah.
Thank you.
Thank you.
Thank you, Doctor. And Doctor, we have one more wonderful speaker with us, and it's time to introduce our next speaker, uh, Helen Davis. Helen Davis is the England G100 Regional Chair for the Mental Health Wing, part of a global community dedicated to promoting mental well-being worldwide. Helen is also a county clinical director for trauma-informed approaches and a former neurodivergent clinical director. Her journey began as a child with undiagnosed neurodiversity, and she entered nursing through an entrance test. Since then, she has climbed the rank in nursing and founded a not-for-profit enterprise focused on neurodivergent inclusion. Her organization offers group coaching, workshop, and neurodivergent business membership community and a quality marker for neurodivergent inclusion. Alongside her work with the G100 movement, Helen is on the mission of to address inequality and tackle key mental health challenges in the UK. We are very delighted to have you, Helen, today with us, and the floor is all yours.
Thank you very much. Yeah, wonderful. Hard to follow the other speakers before me, but I will give it a good go. Yes, and I certainly think that mental health is such an important leveler for us all, something that very much affects us all, and we can see that it's something that is close to a lot of people's hearts because we all tend to know somebody who might have that, and so I'm just going to cover it in a more broad sense. Um, and I know that you have this series for the whole year. And I was also, very much wanting to talk about why it's everybody's business, because it is indeed everybody's business. And what I was thinking here in terms of a global perspective, mental health disorders like depression that we were talking about a little bit about, anxiety, post-traumatic stress disorder, they affect hundreds of millions of people worldwide.
which means there are no borders to it. It's not something that just keeps to one country, one particular boundary, one particular family. It's something that is actually universal around the globe for us all. In certainly some things can exacerbate. So we've got crisis and stressors that can actually make it worse. We had that small global pandemic not too long ago now. And that very much caused a lot of angst, a lot of stress. And actually, certainly in the UK, we seen a surge of mental health conditions since we had the coronavirus. There's obviously things like wars, poverty, displacement, climate change, all of these things having an impact collectively on the mental well-being. As was shared before, you know, you can kind of, because we're now a global community, we can feel these stresses rippling out. And the ripple is felt in families, in communities, in entire nations. And why would we actually try and do anything? Well, there's very much the human factor. It's the right thing to do to help each other. And I know that I'm in very good company right here with everyone with the Ecocivilisation, where we connect people who care. Humanity should be a key part of our communities, something that helps bind us together. There's also an economical factor for those who aren't swayed by just the human and humane factor, and that's the economics of it. There is actually an economical side as well. There's some social as well as economical consequences for us all. So loss of productivity, for me, it's very obvious, but it sometimes feels a bit cold. So for anyone who has a mental illness, please do not think that I am saying this heartlessly. This is just to give a balance of the aspects from this perspective as well. Mental illness is a leading cause of disability and absenteeism from work. So it's the top thing. So of course, that's going to have an impact on us individually, the person who might be off sick, but also on the teams and also on the work that we were trying to do. That doesn't mean you shouldn't go off sick if you need help, absolutely. But there is therefore still an economical impact. There is the healthcare burden, especially in low and middle income countries, that it can, you know, stretch resources. If they're already a bit creaking at the seams, it can stretch them a little bit further, as does any increase in demand. It's certainly something in UK we are trying very much to get on top of, but obviously it stretched what were our existing mental health resources even further. Accessibility, if we look at it from a global perspective, lack of access to mental health care is actually a form of inequality. Something that, as I point out, is that something is very close to my heart, is addressing inequality in its many forms. And actually lack of access is very much one of them. But let's not forget that it's not always declared. You know, and we'll talk a bit more than that in a minute. And I just wanted people to take a second and think about, is the access to mental health care equitable where you are? Does it depend where you live? Does it depend how rich your country is? Does it depend how rich you are? Is there a shared healthcare system, or is it a paid healthcare system? Or is actually it something your family doesn't believe exists? It's a non-issue that actually it's deemed difficult. So is it equitable where you are? It's very much compounded by a number of factors. So people with mental health illnesses often face discrimination and exclusion. The stigma and the lack of awareness can be really very heavy burden. And that's no wonder why there is fear of actually disclosing it. And this can lead to underdiagnosis and then it undertreated. We had some very passionate pleas about going to get support from qualified professionals. And actually, sometimes people hold back because of all these stigmas that we have from our neighbors, from our friends, from our family, from our employers, for our fear of our jobs. It's also compounded by, and I think more and more is what I see, and this is me more as a nursing clinician, the increase in isolation. It's literally heartbreaking. I have been into patients' houses where one lady definitely had a mental health issue. She had a hall with a couple of rooms off either side, but she was in a chair living in the hall. I was asked to go in to help with her bandages, which is what I did. But that's because her son once came and said he would come back to collect her and she would live with him. When asking her, this was a couple of years ago. But obviously that ideology, that hope was something she very much hung on to, and it caused her not to actually live in any of the flat, but actually live in the hallway. That's very much somebody who's isolation, but also suffering very much from some some mental unwellness there, definitely. And we just have increased isolation with we have increased connectivity, maybe in technology, but not with the human factor necessarily, and that can cause issues. And Mark, you might say, why bother? Is it really so common? How prevalent is it really? Well, I thought it'd be useful to have a little look at this from a global perspective. Depression has a global prevalence of over 280 million. It's the leading cause of disability worldwide. Anxiety disorders, 301 million, often co-occur with depression. Bipolar is significantly less, but it's still 40 million people with chronic, with mood swings between highs and lows. Schizophrenia is 24 million, and that affects about 1 in 300. Eating disorders, 14 million, especially prevalent in adolescents. And dementia with 55 million, and that's expected to rise with an aging population. In fact, when we look at the prevalence, it's 1 in 8 people. And if you look in a room, maybe where you're sitting, or when you're going to the supermarket, or when you're in the office, when you're going to work, or at university, wherever you are right now, at some point when you go around and you see that 1 of 8 people will be having a struggle of some description, that is quite a staggering statistic. Mental health disorders account for 15% of the global burden of disease in people aged between 10 and 49. I certainly know that in the UK, the most stressed cohort is our young people. And I think it's very much connected to these smartphones or other controlling devices. I don't know, that's a whole different debate. But it's very much connected to that. But I am still a believer in connection. I'm caring. You're on this call today. You're with me. You're caring too. I think we have hope. We can together reduce the stigma. We are part of a community, and many communities, more than one. And we can influence how things are talked about, how things are shared, what compassion we show each other, and even ourselves. Sometimes the harshest critic I ever meet when I'm supporting my neurodivergent communities is themselves. And that's because sometimes the stigma and criticism can be internalized, and that stays with them for a lot longer. So it's about compassion inside and out. It's about community, as I've said, and services, obviously. Having access to different services, addressing our inequality where we can. Organizations like this wonderful organization hosting this today, and other organizations which can very much still make a difference. We collectively can all make a difference. And within an organization, that's a hell of a lot of power with us standing side by side together. We can actually try and address the status quo. Look at policy changes. that's certainly something that I want to look at, is see where are the opportunities for policy changes. And that's something that I would want to do as the England lead for the G100 wing, to actually look at what impacts I can make to help my fellow countrymen. And so together, I very strongly think we are stronger. There is a lot to play for. There's a lot to live for. There's a lot that can make a difference. We can look outside our bubble for just one moment. We will look and be able to touch and feel and support each other. I think together we are healthier as well as being stronger.
Thank you so much, Helen. Wonderful words. And you touched upon some of the very significant words through your slide, hope, where you talked about empathy, you talked about stigma. And stigma is again such a crucial thing to address in sessions like these. And I often feel, and this leads me to ask you a question. In the field of psychiatry, I have seen that every time a patient who is suffering, the person who is suffering, is referred to as a patient. Even in front of doctors, nurses, everybody. Because if the doctor is making staff explaining something, every time the doctor is referring to that person, patient. And and actually, I think subconsciously, and you are into this profession, you have more ability, capacity to understand the impact of words like these. Do you think there should be some other alternative word to address those people who have already undergone some trauma? There should be some better terminology rather than calling them patients.
It's interesting because in healthcare, like we could, yes, we do use the word patients quite well, about where if you worked in social care, they say clients. It's so even within the two public sectors, there's different views of it. I do think that the power dynamics are loaded. Actually, when you go to seek help, it's automatically loaded straight off. I think there's quite a lot of institutionalized approaches that actually sometimes encourage a medicalized model, not decourage. There's something very much, for example, in hospitals, like how people, I'm not saying they're not sick, but go more into the sick role. So, for example, get the pajamas out and stuff. There seems to be a certain way of being, and I think that it's not always challenged in a more empowering way. But I think that the moment that you go and see somebody, the power dynamics are different because you're actually seeking help. Could you use a different word? Yeah, definitely. I think you could. I guess when I do my own work with my coaching and group coaching, we just call each other by our name. Funny enough, it's not I don't really, at the end of the day, I'm quite simple. I say, if what I'm offering can help you, whether you are neurodivergently aligned, a maybe or a diagnosis, then come. Because my whole point of the not-for-profit is to help people. So for me, it's about one person helping another person with what their particular skill set is. But then, I've always been a person, even when I was lead nurse and elderly care and stuff like that, when the most important person in my team is the cleaner. They're stopping the infection, they're keeping it all okay from everything is needed to be healthy. And, and I don't see a higher, even though there is a hierarchy in my head, we all got different roles to do. So, that's my particular paradigm that I come from. Yeah.
Right. So your suggestion is, instead of calling the sufferer in
Use their
that
name.
condition, use the name, or
Person.
client. Yes, a
Person.
client also seems better than patient. Yes, Dr.
Person.
Bideker. Yeah.
Client is
Yeah,
okay, and then person is okay.
person. Yeah,
Yeah, I
good
think
idea. Good
person,
idea.
yeah.
Yeah,
And
Dr. Swati.
Swati, and then you also have Carrie and
Sh-
wants to talk.
Yeah.
Yeah.
So
Yes.
in in terms of, when we are addressing people in terms of, say, research, or we say person with lived experience.
Yeah.
So it has been a term which is very current, persons with lived experience. You don't want to label somebody like he's a schizophrenic, or somebody with a illness or a disease, or so just a person with mental illness, or a person with lived experience. So it's not, you're not really labeling anyone.
Right. That sounds good.
Yeah.
Yeah, yeah,
Yeah.
yeah. And Dr. Mr. Srinivasa Murthy, we have
Yeah.
we see one
Can I
more
come
hand.
in?
Yeah.
Can you hear
Yeah,
me?
yeah, please.
Yeah.
Yes,
Thank
yes,
you
we
very
can.
much. I am a retired professor of psychiatry from Bangalore. I especially liked Dr. Bedeka's emphasis on self-care. But I want to touch upon the area of stigma, which was raised by all of you. I think our difficulty is we are with the baggage of mental hospitals and the issues relating to hospitalization. I think we need to move away from mental illness to mental health, from patients to population. And there is now enough evidence to show that each one of us can take care of ourselves, as pointed out by Dr. Bedeka. Exercise, sleep, nutrition, connectedness, spirituality, journaling, music. I personally feel that we must go to the population to talk about, when you have problems, come to me too. You can take care of your mental health even when you are not having a problem. And we have done some very good work in this area with caregivers in Bangalore, caregivers of special children. I'll put down my number and email. I'll be very happy to share this with you. So the important point which I'm making is, let's make it a people program. Public health, not by the people, of the people, but for by the people rather than of the people and for the people. Thank you very much.
Thank you. Thank you so much, Dr. Srinivas. We appreciate your participation and adding value to our session. Thank you so much. And also, I would like to inform you that on 23rd of April, the next topic of our webinar is about breaking stigma only. So we would be happy and appreciate that if you could spare some time to participate in our session. Thank you.
Yeah. It's a very, very good point.
Can I add a perspective here after what Dr. Murthy said?
Sure, please.
One of the things that we need to really move away, and I really agree, the stigma comes from the hospital. I remember I grew up in Bangalore, and there's the Nimhans over there. So even when we used to go in the bus, like the bus conductor used to joke saying, okay, who wants to get off at the mental hospital? So the mental hospital stop has come, and then people would laugh. And we used to go and volunteer there as students in the mental hospital, NIMANS. And so that stigma is still there. I mean, that view that, mental patients are chained and they are dangerous and all that stuff, that they can't decide for themselves. There's a disability and all that. More and more approaches in the current times are towards community wellness, community based programs, interventions. I think those would be more, bringing mental health and awareness and wellness more towards these communities, rather than just making it like a illness factor, rather than, mental health and wellness. So I think we need to just, it's a paradigm shift.
I just come in there. I do believe the community has a massive factor, and I think part of the problems we've got is because we've pulled apart. Even though we're meant to have this social inclusion and connection with the technology, it's actually not the sense of community, and that I think that's actually exacerbated a lot of the issues.
Absolutely.
And if I can come in for a brief,
Rajni, you're muted, so we cannot hear.
Sorry.
I am
I
unmuted.
apologize.
Yeah.
Yeah, we can hear you.
Me? Yeah.
Yes, yes, we can hear you.
What happened was, during the COVID, I was working with a school for the mentally retarded children, intellectually disabled children. And when we offered services, we found that no one was willing to come to us. I offered free services, it was, and they all knew me. And then when we sat down and talked to them, they said, look, I'm not bothered about myself, I am bothered about my child. So then we twisted it around saying that I want to live for my child. How can I live longer? And then build the mental health around that. These are the 5 things you can do which will make you live longer, 5 to 10 years longer. Exercise, sleep, nutrition, connectedness, and yoga. And when you are upset, these are the 5 things you can do. Talk to someone, journaling, music, spirituality, thinking differently. And this, they found it to be more acceptable than saying that I have depression or I have anxiety, I am worried about it. So I think the whole mental health dialogue has to move to like the beauty business. What we are doing now is we are running ugly boutiques, saying that when you are ugly, you come to us, no one will come. But if you say, here is things which you can do for becoming beautiful, then when they have to go for a wedding or some other thing, they will come to the boutique saying that I want to look more beautiful. No, I'm not saying it lightly. I've done a lot of work in this, particularly written a lot and researched about it. As I said, I've left my email on the chat box. And this is something which will make a big difference. I end up saying that, about a few years back, Dr. Saxena, who was the director of mental health of WHO, he said, when it comes to mental health, all countries are developing countries. We can't change it. We have the technology now, and we have to make it a people's movement rather than illness movement. Thank you very much.
Thank you. Thank you, Dr. Srinivas. Violeta, you wanted to say something.
Yeah, I just wanted to ask because several of you mentioned this importance of institutional frameworks. I mean, all 3 of speakers, but at least in the country I know best, we have really, really huge difficulties passing a law for psychoanalysts to have a legal framework in order to deliver their services. Do you have any information how many countries around the world actually have a legal framework within which this can be professionally delivered?
I don't from a global perspective. I know that we have different bodies, and some are more regulated than others. So therapy is much more regulated. Qualified doctors is regulated. But then when you look at coaching, for example, you can call yourself a coach after a 6-week course or with nothing at all. So it depends which
What
is
about
what.
psychoanalysts?
So that's got a clear body, professional body. Yeah.
But you don't know how many have passed this law around the world.
No, I don't have a global picture. Sorry. No.
Thank you.
We do have in India a Mental Health Care Act. So we have always had that, but it's towards the mental health practitioners. It doesn't cover a lot of other things. So, for example, training standards are not there. I mean, so in India, you pretty much have unqualified people trying to provide therapy. So there has to be some standardization, some quality, that a lot needs to be done really. So
I think this is a work that is ahead of us. Maybe we could start encouraging and stimulating them, because if we don't have that, as you mentioned, standards and some sort of framework within which you know who's qualified, who's not, and have a real clear information for the users, it would be hard to give a quality level of services. Thanks.
Yeah. And I think that's a very good point. And I think particularly for that, but and behind that for me, my particular area, apart from trauma-informed approach, is also the neurodivergent world, which is where I kind of feature. And we are deliberately creating a quality standard, and with different tiers, with very clear standards that we would want or would hope that for that to have a global impact, not to be something that is just specific to one bit, our little corner of the globe. Because of all you say, yeah. So you know that this is a level of standard that you can accept. Yeah.
if I may add to that, and I would love to get your input from all of our speakers, from my own kind of experience in counseling as well, I've found that it's almost like we have psychology, or the formal psychology kind of like field, and then we have coaching. And I often find that if we could just bring these worlds together, we could create like a holistic, offering to most people, and also make it less confusing. And I find that there's a little bit of gaps in coaching education, which psychology could bring in, and vice versa. I think shared knowledge and experience would be super helpful for us all. And I would love to hear your input about that.
Yeah, I think that what you touched on though is that is such an unregulated body in the coaching world. And I think that variability is problematic, whereas you literally have the opposite, very, very regulated, well, anyway, certainly in the UK, so that they feel like worlds apart sometimes. But actually it should be, in my head, is like a continuum of expertise, and people can go in at the right level that they need. So I won't go to a neurosurgeon for a finger cut, but but I would really love to see him when I need it. And so for me, I think maybe how I would think is how we can do that continuum, but at the same time, how you can also improve the coaching standards actually.
Do you have generative coaching in your place?
What you
There
mean
is
in the
something
UK?
called generative coaching. IAGC, International Association for Generative Coaching.
Yeah, I think that we do. We have a few bodies, but you don't have to be a
You
part
have,
of
I
it.
know.
Yeah,
Yes, in London and various places. You
yeah,
have it all over. So that is worth looking at, because that is actually as good as therapy in disguise of coaching.
yeah. Good point.
So you do coaching and you do therapy. Yes. It is IAGC. Stephen Gilligan, Irishman person in America, he's done work on that. Very, very much like I'm also an IAGC coach. I did it twice.
Excellent.
Mhm.
Okay, I would like to request all participants once again to feel free to jump in and ask any questions if they have, because we have few minutes left in case they have any questions which they feel can be addressed online. Because see, as you understand that mental health is something which cannot be addressed until the specialist see the patient, meet the person, in person somebody gets the advice. That is more preferable, though nevertheless at broader level, uh, our specialist can guide you in case you have any question. Anybody?
So
Dr. Violeta, do we have any questions, or do you have any questions, or shall we?
No additional questions, mostly comments. So that's pretty much it. So I think it was a very, very intense and very useful conversation altogether. We had the basic definitions, we got some very hands-on practical advices, and very global overviews. So this is perfect for the second session, which is basically laying the ground for all more focus sessions in the forthcoming months. So I would like to, in the name also of Ecocivilisation and the whole organizing team, to deeply thank you and for being so generous and sharing your insights into this really important emerging topic. So I hope that, especially now that we're going to use this material and distribute it through social media, and hopefully your contributions will be also present in our book, we will continue to follow our mission, which is raising the awareness, then really decomposing all the fears and sort of misperceptions around this topic, and eventually helping some people to get access to the tangible tools with which they can address their own challenges. So,
Absolutely.
thanks a lot.
And I think Dr. Bedkar, Dr. Swati, Helen, Indrani has posted, one of the participants, Indrani has posted a question. If you feel that you are uh, in the position to answer it here, you can answer. The question is, does small vessel ischemia in the brain leads to Alzheimer or dementia in future? This is her question, I guess.
Very multifactorial. There are many causes. So not very simple, but yes, both are similar and both it can cause. Small vessel disease, both can cause.
Okay. Yeah. And it's good that all of you have shared your numbers in case anybody wants to access, reach out to you. So anybody can reach out for professional help and to seek one-on-one advice and guidance and counseling. So thank you so much. And as Violeta also said, that this was truly an insightful and impactful session. A huge thanks to our esteemed speakers, Dr. Swati Karve, Dr. Om Bedkar, and Helen Davis for sharing their valuable expertise, knowledge with us today. And we also extend our gratitude to all our participants for their active engagement, their thought-provoking questions. And I want to thank them that their presence made these discussions truly enriching. And let me also inform all our viewers that our next webinar is on 23rd April. And as I have already stated, that the topic we are going to take this time is about breaking stigma related to mental health. So for more upcoming events and more information, stay tuned and keep visiting the website of Ecocivilisation. And thank you once again, all speakers, for joining us. Thank you for all participants. And thank you all speakers once again, and take care and goodbye.
Thank you. Thanks so much.
Thanks.
Thank
Thank
you.
you, everyone. Bye bye.
Bye-bye.
Thank you. Bye.
Photo निकाला कि नहीं? I think we've done the recording.